Hello, I'm Dr. Ken Landau. Thanks for joining us. This is Well Now Doctor. We're going to be discussing vitamin D. Now, vitamin D sounds like it ought to be a very simple subject, but I assure you it's not. We have a variety of people telling us that our vitamin D levels are too low, that we need to go and get some more vitamin D, we need to take supplements, we need to go and spend more time in the sun, because after all, if you don't get enough sun, then the skin is not going to be able to manufacture the vitamin D. If you don't get enough vitamin D, it's supposedly going to be very harmful for your bones. It's going to lead to rickets or osteomalacia or osteoporosis. It's going to lead to increased fragility of bones, bone fractures. Obviously all bad. And now people have expanded on the topic and say, well, look, not only is the vitamin D important for your bones, but it also is important for a variety of other areas of the body, other systems in the body. So some people are saying that vitamin D, if you get enough, will prevent cancer. Other people say it will prevent infectious diseases. Some people say it's very important for your heart, so if you don't get enough vitamin D, you're probably going to have a premature onset of heart disease, and the list goes on. Question is any of it true? Now, we know that vitamin D actually doesn't really fit the story of a vitamin, but actually it's a hormone. It's in the hormone family. And the vitamin D that we take is actually a prohormone, not a typical vitamin. The structure of vitamin D actually looks more like a steroid hormone. The concentration in the body, very, very small, the activated form of vitamin D. We know that we spend an awful lot of money on vitamin D supplements, probably unnecessary. We know that at the present time, people are spending somewhere in excess of $500 million on vitamin D supplements. Don't even know what you're getting or how much you need. You know, it's become a cause célèbre in medicine, and if you look at the number of times that vitamin D metabolism has been invoked in diagnosing medical disorders, it's considerably greater than it was 5 or 10 or 15 years ago. Now, we have an awful lot of people who are really zealots, people who actually are trying to sell us vitamin D, people even in the medical community, people who say all sorts of things about what vitamin D can do. They say, some reputable sources, that vitamin D and a lack of vitamin D might be responsible for as many as 13% of all deaths here in the United States. Maybe as many as 9% of all deaths in Europe. People come up with an idea that if you take vitamin D, you're going to be able to reduce the likelihood of developing cancer by maybe as much as 70 or 75%. But let's just take a look at some of the kind of information and how it's basically absolutely useless. For instance, in one study, it was done in Omaha, and what they did is they looked at people, they looked at about 1,200 people, and they divided them into 3 groups. One group received a placebo, one group received calcium, the other group received calcium and vitamin D. And what they found in a 4-year period was that in the placebo group, there were 18 deaths. Okay? In the group that received the calcium only, when followed for 4 years, there were 15 deaths. So right away, that's a 40% reduction in the incidence of death simply by taking the calcium, according to them. But more importantly, if you take the calcium plus the vitamin D, and that's very important, calcium plus vitamin D, not just the vitamin D by itself, but if you take it with the calcium, there were only approximately 8 deaths in that group. That means that there was a 78% reduction in the deaths in that 4-year period if we look at the people who died from cancer. Now, what does that mean? Well, it means that when the American Cancer Society looked at that kind of information and those kind of claims, they said, oh my gosh, this isn't true. This isn't a legitimate study. This isn't kind of information that we can really rely upon. Another study looked at vitamin D and said, look, those people who have low levels of vitamin D, well, they have a 17% greater likelihood of dying than people who have normal levels of vitamin D. Well, right away, that sounds like you ought to run out and go get a bottle of vitamin D. But what they really found was that if you look at people who were otherwise normal, vitamin D level didn't seem to make any difference. It seems that the vitamin D may have been associated with, not cause and effect, but just associated with a higher incidence of death in those people who were older, institutionalized, and in poor health to begin with. So yeah, we do know that the vitamin D level is going to decrease with a variety of inflammatory diseases, with poor health, with being in a nursing home so you're not getting any sun. So the question is, what does that kind of information mean? A 17% reduction? And we have some zealots now who are saying just in the United States alone, if we get enough sun, if we go out and spend those extra hours in the sun, we might be able to reduce the likelihood of death here in the United States by 400,000. Absolutely ridiculous. There is no way that's going to happen. Some people estimate that if we look at the world in general at the present time, we have over 1 billion people who supposedly are either vitamin D deficient or vitamin D insufficient. So according to those experts that you hear quoted all the time, the vitamin D level is horribly low. We better go and do something. And as a matter of fact, if you look at pregnant women here in the United States, estimates suggest anywhere up to 100% of women who are pregnant are deficient in vitamin D. 100% of the women deficient in vitamin D in Canada, somewhere between 1/3 and 2/3 of the women in Europe. Again, somewhere up to 100% of the women are deficient in vitamin D. That's hogwash. These are the zealots talking. If we look at kids who are between the ages of 1 and 5 here in the United States, it said that half of them, 50% of the kids who are otherwise normal, otherwise going outside and playing in the sun, are deficient in vitamin D. And if we look at the kids who are a little bit older, say between the ages of 6 and 11, it said that as many as 70% of those people are deficient. Now, other studies show here in the United States, if we look at the Caucasian population of adults, otherwise healthy adults, and we define a vitamin D deficiency as less than a level, when you go to the laboratory and you have them draw your blood, less than 20 nanograms, and that's pretty generally accepted, that if you're less than 20 nanometers as far as your vitamin D is concerned, that you're low. Well, it's found that at least 1/3 of the Caucasian population is low. If we look at the African American population, it said that 3/4 of them are deficient. And if we look at the Hispanic population, we find that just shy of 50% are deficient in vitamin D, if you believe those numbers. I happen not to. I think it's absolute nonsense. If we look at the Canadian population, they use a little different definition. They say below 30 nanograms. And even below 30 nanograms, almost 2/3 of Canadians are deficient in vitamin D. And if we look at the European population, otherwise healthy people, 3/4 of them are deficient. Now, if we go to Australia and do some studies, we can say that this population, where the incidence of skin cancer is horrendous because people spend so much time in the sun, well, if we use a definition like we do in the United States of less than 20 nanograms when we go get our vitamin D analyzed, we find that at least 1 in every 3 people are deficient in vitamin D. And if we use the Canadian definition, if we go up to 30 nanograms or less, we find that around 3/4 of Australians are deficient. Now, right away, I think we can say that we have a problem with the definition. We don't have a problem with the population not being healthy. We have a population that's otherwise well, and we're saying that they're not well because somebody has defined an arbitrary level to define a disease. Now, interestingly, supposedly it's a sunshine vitamin, right? So the more sun you get, the higher the level of vitamin D in your system. So how about we go far away from the equator? Let's look in Europe, let's look at those northern Europeans versus southern Europeans. So we're looking at people in England and the Scandinavian countries and Norway, and we're comparing them to the people around the Mediterranean, people in Spain or people in Italy, people in Greece. And you would say that those people in the northern climes would, by right, have a lower level of vitamin D than the people in the southern, in the Mediterranean. Actually, the exact opposite is true. Why? Well, because the people over in Norway and the other Scandinavian countries, they consume a fair amount of fish, and fish has a lot of vitamin D. They also consume a fair amount of cod liver oil. Cod liver oil has a lot of vitamin D. If we look at people in Western Europe versus people in Eastern Europe, we find again there is a significant difference, a difference that's unexpected. Now, it's not just that you have the vitamin D, it's not just the vitamin D that has receptors in the bone, you see, because it's not just the vitamin D floating around in your system, it's the activated form of vitamin D that we'll talk about down the road, but it's the activated form of vitamin D, not the kind of vitamin D you take by mouth, not the kind of vitamin D that you get because the sun impacts on your skin. Those are inactive forms. They have to be converted, serial conversions in the body in order for them to become active. But vitamin D has receptors, and it was thought that those receptors, once upon a time, were only present in the bone. Therefore, we have all the conversation about the vitamin D and how it's important on your bone metabolism. But more recently, it's been found that these receptors, these areas where the vitamin D hones in, are actually present in a large number of tissues, if not all tissues. Present in the brain, present in the bones, present in the prostate, present in the colon, present in the heart, present in the immune system. So we know that the potential for vitamin D interacting with a lot of cells, well, it's very important. And as a matter of fact, we said that the vitamin D you take in, the vitamin D from the sun, is inactive. Has to be converted. First, it's converted in the liver, then it has to go to the kidney, where it's finally converted into the active substance. Well, originally it was thought that the receptors were only present in the kidney, so the vitamin D had to go to the kidney in order to work, and then it was thought that the enzyme that would activate the vitamin D was present only in the kidney. Now we know that that enzyme is present in a variety of tissues. We call it 1-alpha hydroxylase, and that's a very important enzyme. Well, this brings up a question. How are we going to define what a vitamin D deficiency is? Well, obviously, we have to have the experts tell us, and how are the experts going to decide? Well, once upon a time, it was thought that vitamin D would be deficient if your bones were deficient. So if you didn't get enough vitamin D in when you were very young, when you were a child, you would develop a condition that we'll talk about a little bit later called Rickets. Well, it was thought that if you didn't get enough vitamin D and you were an adult, your bones had already formed, your bones had already matured, basically had gone through puberty. Well, then it was thought that you would get a condition that would be similar to the Rickets, but in adults we call it osteomalacia. So that was one definition. Another definition is we know that if you have enough vitamin D, if the calcium metabolism is normal, you're not going to be manufacturing a lot of hormone called parathormone. It comes from the parathyroid glands. You have 4 parathyroid glands. Each of them is about the size of a grain of rice. They sit right behind your thyroid. That's why we call it the parathyroid. Well, it's thought that if the parathyroids were relatively inactive because you had enough calcium floating around, enough calcium because you were absorbing it because the vitamin D was doing its job, then that should be considered normal. Well, it was found that at that level, you would have to have a vitamin D level, the kind of vitamin D that we measure, of about 32. And remember, we said phenomenal percentage of the population doesn't even have a level of 20. Well, then it was said that, well, how about if we'll define it as the amount of vitamin D that you have in the system, for which if we add more, we're not going to get any significant changes in the level of the active form of vitamin D. We're going to call the active form of vitamin D 125 dihydroxyvitamin D. Doesn't matter the name, but that's just the active form. Well, we found that that would be at least 20 nanograms. But interestingly, we can go on and on and on with our definitions, and we can find that there's wide variation in what's really happening metabolically. If we do all the studies, if we do the studies of the parathyroid hormone, we did the studies of the calcium absorption, the levels of vitamin D in the kidney and elsewhere, we find that there's no guarantee that any of these are going to be accurate. We don't have an internationally recognized definition of what a vitamin D deficiency is. It all depends on which particular expert has the floor for that particular day. But what we can say is that irrespective of the definition, by current thought, the incidence of vitamin D deficiency is somewhere between 200 and 900% greater in African Americans than it is in the Caucasian population, and we can say that a Hispanic is 200 to 300% more likely to have vitamin D deficiency than a Caucasian. But if it has to do with your bones and the health of your bones, who's more likely to suffer a bone fracture? Is it an African American, is it a Hispanic, or is it a Caucasian? Well, since the African Americans and since the Hispanics seem to have a lower level, aren't they the ones who should have the higher incidence of fractures? Well, yes, indeed, they should, if the definitions mean anything. But who gets the fractures? Then generally older white women. Well, American Indians. American Indians seem to have a greater likelihood of low levels of vitamin D than the Caucasian population. So again, if we look at American Indians, they should have a lot more fractures than the Caucasian population, but exactly the opposite is what we find. If we look at an elderly group, well, what's the likelihood we're going to find that they are deficient? Well, it's somewhere between 50% and 100% at the current levels. Now, interestingly, they did a study here in the United States, and it's done by the federal government, and it's called the NHANES study, the Nutrition and Health Examination Study. And what they did is they actually drew blood on a wide range of people throughout the country. And what they found was that if you use a definition of less than 20 nanograms per milliliter, then it was found that somewhere around a third of the population would be considered deficient in vitamin D. If they use the somewhat higher level, you have less than 30 nanograms, well, it was found that somewhere between about 3/4 and 90% of the population would be vitamin D deficient. They did a similar study in Omaha, Nebraska, and they found basically the same thing. As a matter of fact, they found that about 1% of the population had a level of less than 10 nanograms. So really deficient according to these people. Now, what's the average level here in the United States? Remember, some people would say if you're less than 20, other people less than 30, you're deficient. Well, here in the United States, the average level among the Caucasian population is only somewhere between 23 and 26 nanograms, and I guarantee you that we don't have major bone problems in the overwhelming majority of the population. And if we look at the African American population, the level is considerably lower than the 23 to 26. So supposedly, the African Americans would be breaking their bones like crazy. And as a matter of fact, we find that the sun is indeed helpful. So over the course of a summer, any given summer, it seems like the average vitamin D level increases by about 30%. Now, some people say that that would be equivalent to as much as 2,000 units of vitamin D consumption a day. Nobody's getting that, basically, unless you're taking a pill. And as a matter of fact, as we'll talk about later, those people taking the pill might actually have a higher death rate than those people who aren't taking the pill. Now, if we look at women who are postmenopausal, women who are over age 50 or thereabout, women who are being treated for osteoporosis, Well, it's found that at least half of them have low levels of vitamin D levels that would be considered deficient. And when we go to Boston and when we go to other cities in the Northeast, and we look at the population, we find again at least 50% of the population less than the break point. The break point being defined as 20 nanograms. So the experts tell us if you're less than 20%, or less than 20 nanograms rather, then you're deficient in vitamin D. Can you believe it? The absolute answer is absolutely not. It's hogwash. Up until 1998 or thereabout, it was thought that if you had a level of vitamin D that was somewhere between 11 and 25 nanograms, you were quite okay. Now, some people have raised that to 20 nanograms or 30 nanograms, and other organizations say it's better to be somewhere between 30 and 60, maybe even up to 100 nanograms considered normal. If you look at the Institute of Medicine, they say, look, if you're less than 12 nanograms, you're probably at risk for being deficient. If you're between the levels of 12 and 20, well, you're still somewhat in that group, but maybe a little less at risk. If your level is over 20, according to the Institute of Medicine, that's a level that we can say is okay for about 97.5% of the population. But, you theoretically could get too much vitamin D in the system. And if you got a level of vitamin D in the system, some people say it would be more than 50. Other people say, well, better level is about 150. Hardly anybody is going to get to that level. Well, you could have some sort of toxicity. Well, adding a little bit of confusion to the whole subject, as if it weren't confusing enough, in 2011, we had the Endocrine Society. That's the group of professional endocrinologists, the medical doctors here in the United States, and they say that it's desirable to have a level of vitamin D in your system that's at least greater than 30 nanograms. They say ideally somewhere between 40 and 60, and according to them, up to 100 is perfectly safe, and you should probably be taking, according to them, somewhere between, for adults, 1,500 and 2,000 units a day. Nonsense. And if you're a kid, if you're a child, you should probably be taking somewhere around 1,000 units of vitamin D a day in order to get to those levels that are considered healthy. But that's absolute nonsense. So let's look at pregnant and lactating women. Women who are taking their prenatal vitamins, women who 90% of whom are consuming fish during the course of the pregnancy, women who in 90% or more are consuming several glasses of milk, and let's assess them, and we find that according to the current definitions, that somewhere around 70 to 80% of those women do not have sufficient vitamin D in their system. So as a result, what we now have is we have a condition, we have a diagnosis, we have a medical disorder, insufficient vitamin D, that's being diagnosed simply on the basis of a blood test that makes absolutely no sense, that really doesn't test anything, that doesn't even test the active form of the vitamin D. And we're making people go out and we're telling them that, oh my goodness, you have to be checked because your vitamin D level is too low, and oh my goodness, you need supplements. Not that they have any symptoms, not that they have anything wrong with them, perfectly healthy individuals. Somewhere up to 100% of perfectly healthy individuals being told that they don't have enough vitamin D in the system. And to make matters worse, I'll tell you how stupid this whole thing gets. Well, this is the sunshine vitamin, right? You go out in the sun, and the sun impacting on the skin is going to increase the level of vitamin D in the system. The ultraviolet rays interacting with certain chemicals that we'll talk about later in the surface of the skin, going to manufacture the substance that ultimately in the liver is going to be converted to the chemical, the type of vitamin D that's measured in the laboratory. So those people who get a lot of sun, those people who live in the sunny climates like we talked about before in Australia, those people should have relatively high levels of vitamin D. After all, they tell you, go out in the sun because you really need your sun. You have to get your sun. If you don't get your sun, you're not going to get enough vitamin D. Well, let's look at people in Saudi Arabia. Let's look at people in the United Arab Emirates. Let's look at people in India and Lebanon. Let's look at those people in Australia. And we still find that up to 50% of those people are considered to have low levels of vitamin D. And let's study doctors. Doctors who are concerned about the health, doctors who theoretically know what the story is. Well, when we assay the doctors, the residents at the hospital in Boston, when we analyze the medical students, we still find that at least 30% of those or more have low levels of vitamin D. And as a matter of fact, when we study people, we find that the African American population is somewhere around 90% less capable of converting the vitamin D in the skin. And remember, vitamin D is supposed to be very important as far as fractures are concerned. So what's that mean? That means that supposedly, if the African American population is not able to get enough vitamin D, they're going to have fragile bones. And if you have fragile bones, they're going to fracture. You fall down and fracture. Well, guess what? Doesn't happen. So let's do a study, again, talking about people in the world, people who are out exposed to sun. Let's talk about the Maasai, and let's talk about the Hadzabe. These are people in Kenya and Tanzania. And those people are basically on the equator. There is no region in the world that gets more sun on a uniform basis than those countries around the equator. And these people who are out in the sun all day, they're nomadic, they're constantly traveling. What happens with them? Well, we find that the level of vitamin D in that population, with all of the sun, still is only in the mid-40s. So the question is, if we're trying to decide if you have a deficiency of vitamin D, do we have a test that can monitor that? Or are we measuring the wrong thing when we measure the standard laboratory test? When you go to the laboratory, they're going to test for the form of vitamin D that's known as 25-hydroxy vitamin D. That's the standard test. Vitamin D test, that's what you get. So the question is that a good test? And the answer is absolutely not. It's a terrible test. Doesn't tell us anything. What we want to know is what's the clinical implication for your bones. That's what the test should be all about. And some of these studies that we talked about, studies that show that the people have a reduced incidence of cancer, reduced incidence of fracture on the basis of the vitamin D, do they mean anything? Are they legitimate studies? And the answer overwhelmingly is no. These are not what we call randomized controlled studies. These are observational studies. You look at a group of people. But the kind of people who are participating in the tests, kind of people who are participating in the studies generally are healthier overall. They're not the general population. They don't have a lot of medical diseases. And as a result, the kind of information that comes from these studies is not very interesting, important, or correct. So in some studies, it's shown that if we look at the all-cause mortality in people who are deficient in vitamin D is supposed to be somewhere around 25% greater than in the general population. Well, okay, so we're talking about the studies. But in the group that are deficient in vitamin D, these are the people who have a variety of chronic illnesses. These are people who are cigarette smokers. And interestingly, they don't have a lower incidence of cancer-related deaths. They have supposedly a lower incidence of cardiovascular-related deaths than otherwise. Is there any evidence that really shows that that's indeed the case? And the answer, again, is absolutely no. And as a matter of fact, if we look at the vitamin D in your system, this 25-hydroxy vitamin D, and we try to assess it, we try to make something out of it, we try to understand why it's different in different people, we find that we don't have any good explanation. It doesn't have to do with the amount of sun that you get. It doesn't have to do with the amount of vitamin D that you take. There are a variety of factors that are much more complicated than simply, oh, go take your vitamin D and you're going to get a higher level. That's not the way things work. We have to consider race. We have to consider the vitamin D in the fat cells. Vitamin D is stored in the fat cells. So you can take a lot of vitamin D, and if you happen to be overweight, especially if your body mass index is over 30, well, the vitamin D isn't going into your general system. It's going into the fat cells and sometimes into the muscle cells. And as a matter of fact, the vitamin D level has something to do with the amount of calcium in the system. So it's very important to realize that all of the studies that show that you can reduce your mortality, it's not simply by taking vitamin D. These studies really mean take calcium and vitamin D and you're going to supposedly do better. But we don't even have that kind of information, and there's an awful lot, as we'll talk about, that has to do with genetics. Your genes determine to a large part what your level of vitamin D is going to be. And simply taking a pill isn't going to change your genetic inheritance. And then we know that there's the responsiveness to the vitamin D. And we also know that there's the duration that you've had a vitamin D deficiency that's going to impact on your long-term outlook. And if we look at the population that supposedly has the lowest level of vitamin D, then we're talking about people who are older, people who are women, people who are African American, and those people who have some kind of medical issues. Maybe they're fat, or maybe they have elevated blood pressure, maybe they have diabetes, maybe they're just from a lower socioeconomic point of view. Maybe we're talking about people who are physically inactive, because we know that the more physically active you are, the greater your level of vitamin D. Perhaps, at least in some part, because you have fewer fat cells. And we know that the fat cells are going to act as a sponge and they're going to take up the vitamin D. So you have it in your system, it's just stored in your fat. People who are pregnant have low levels of vitamin D, as do the people who are institutionalized. Institutionalized maybe because you already have some other kind of a disease, an inflammatory disease, a malignant disease. And we know all of those are going to serve to reduce the amount of vitamin D circulating in your system. Those people who are immigrants, certainly to the United States, from non-Western areas, have a significantly lower level of vitamin D than those people born here in the United States. And we know that one of the things that we like to do is we like to protect our skin. We want to look good forever. We want to look younger forever, so we apply a sunscreen. And if you use a sunscreen that's more than an SPF of 8, you're going to theoretically reduce the amount of vitamin D that the skin is able to manufacture. Fortunately, the whole story about sunscreens is kind of a hoax too, and we know that the way sunscreens are used in the United States does not significantly impact on the ability of the skin to manufacture vitamin D. We also know that bad air seems to have play a significant role in the likelihood of developing low levels of vitamin D. So we know that when there's a lot of cloud cover, you don't get those particular rays that are very important in getting the skin to make the vitamin D. We know that when there's a lot of air pollutants, a lot of ozone out there, that's going to negatively impact on the ability of the skin to manufacture vitamin D. And we also know that the height in the atmosphere has something to do with vitamin D. Well, we'll talk more when we come back next week. And we're going to tell you more about the specifics of how you make vitamin D, why vitamin D is so complicated, why it is that it's not the vitamin D you consume. That vitamin D has to be altered first in the liver and then in the kidney. And then the kidney seems to manufacture vitamin D that only works in the kidney. But if the vitamin D is going to be effective in the heart or in the nervous system or in other areas, it has to be manufactured there. Why is there a difference? And does it really make any difference? We'll talk more later. Thanks for watching.